It is going to the insurance companies, sending letters, going very public on social media and calling them out directly, asking them, what are you going to do to manage this? How are you going to fix these things? Calling out Headway, Talkspace, asking them those same things, because if we get them backed into a corner, they're going to have to maybe relook at it. If they start losing money, they're definitely going to have to reconsider what they're doing, because that's their bottom line. We're not going to win against the insurance companies, though. They have too many lawyers. They have too much money in their pockets. It's going to be pushing for that law change. So when you hear of bills that are happening across the U.S. on state levels, get vocal about them. Join those local organizations to help push it forward. The more states that even start getting bills passed, the more we have that collective ability to also bring it to a federal level. I truly feel like insurance companies want people to stay sick, whether it's mentally, physically, all of that. We push medications too much instead of true ways of helping people heal, because the more that you're sick, the more that they can make off of you versus if you actually get better.
And it's like they're in their end game. They know that it's collapsing and they're trying to get all the money they can before it all falls in on
Well, and people are just
stage capitalism is a term I've been using lately. Yeah. Everybody keeps calling it late stage. We are now in end stage capitalism, everybody.
And people are fed up, right? Like we are using our voice, even, patients, like how many of these, truthfully, like these TikTok profiles, there's the social worker guy that I follow, and people are just fed up. We're sick and tired of being not taken care of and paying for something that really doesn't serve us, right? So with, mental health, it's like mental health has become almost like a buzzword, it seems like, which it's good and bad, right? It's good we're talking about at the same time. Sometimes I feel like it takes away from the kind of deeper conversations around it, right? Like that some of that like legitimacy around the real hard work that happens when you're going through mental health therapy, whatever level it is, right? Like some people need it a couple of times, some people need to go for the rest of their lives, right? But if insurance companies are dictating how that looks, right? Like how that plays out in your office.
I think more of the general public needs to be pushing back to the insurance companies. They're the ones that pay, so they're going to always listen to that money piece. And so if members or communities are asking questions, they're pushing back to their insurance companies, their employers, going, hey, why did you select this insurance if it's not covering what we need? Most of us in this healthcare industry don't even have our own healthcare insurance at this point. We can't even afford what it is for what limited options it gives. I had to take it away from my family because I just couldn't afford it, and cash pay was cheaper for me to do it that way than it is to have an insurance policy as a self-employed business owner. So we need the average people to not just listen, share things, ask questions, make it known, call Blue Cross, email them, tag them and stuff. The more we put the heat on them, the more they're going to have to at least start to look into it. They're tech companies. They are not healthcare providers. They are tech. They are about the money. They're literally following, the more I've read into it, they're following the examples of how Uber had started. So they're taking a lot of clinicians, offering them this great pay. Insurance companies will give higher reimbursement rate to these companies than they will to practices like mine. So my employees get to where like, I got to pay the bills. So they'll go to these companies, but then they're actually making less. They have so much more oversight. They're doing things that are some ethical concerns. And then there's struggles to get out of these systems when the clinicians realize what's going on. So the lawsuits are coming out left and right. It is not about truly keeping clients happy, healthy, and secure and safe. It's just about getting money. And because of the ease of access or the cheaper option that's out there, people are going to it. And I understand why. But they're not understanding how that can impact them on the long-term side, which we're starting to see happen more.
It sounds to me like the insurance companies are trying to shut down your whole industry is what it sounds like to me. Train new people to do the job, like literally not allowing people to learn how the job gets done. They don't want anyone else to do it. I mean, what other motivation is there?
Well, and my thought too is, why does insurance get to regulate who's qualified? If we have a licensing board that gives us our license and they're the one monitoring our continuing education, they're the one making sure that we don't have board complaints, like they're the ones handling our actual expertise. Why does insurance get to then come in and say that they're not qualified? To me, that's where I have my biggest issue, is just that oversight that they're dictating when they have no background in this field whatsoever.
Yeah.
Because once again, it's just money to them. They don't care about qualifications. They care that it's costing them money.
Yeah. They need to stay in their lane, basically. Like, really, like they shouldn't be dictating how care is delivered in an inpatient setting.
Exactly.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com. And we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut up!